My name is Benji, and I'm a person in long-term recovery. I'm one of the assistant directors for the Center for Hope South in Pocatello. I'm a spiritual leader, a mentor, a recovery coach, and a peer support. So my first exposure with any drug was alcohol at 9, marijuana at 14, methamphetamine at 17, and then IV meth use at 19. And meth was my drug of choice. I would describe active drug use to someone who's never experienced or had any exposure to addiction or drugs. In my own experience, I would say that it takes away that self-judgment and self-stigma because all at once it's just so sensational that you don't really care or carry that weight of what others think of you. Oh yeah. How much do you want? Because it's long. So my recovery journey has been very extensive. I got the childhood trauma, the dysfunctional family, the exposure to criminal lifestyle on the streets, and being involved with the criminal justice system, in and out of county jails and prisons and institutions. In that 10-year period between 17 and 27, it was just a downward spiral and many cycles of an unhealthy living style. And then it turned into getting very proactive on a recovery path with the 12 steps, as well as looking for mentors and pillars in the community to role model a type of recovery that I could adopt for myself. So it took 16 to 17 years after exposure to drugs and alcohol to really adopt or feel the desire to want to practice a recovery pathway. At the time, you don't really look at it like, how I'm identifying the situations that are going on. Looking back at it, I would say there were different situations that were happening that contributed to me lacking the ability to understand how they were affecting me emotionally, physically, spiritually, and how they contributed to the downward spiraling. I didn't process it, didn't acknowledge it. In fact, it was easier to lean into active addiction so that I wasn't feeling so conscious over the decisions I was making. So my recovery pathway became the revolving door of incarceration, living in survival mode on the streets, to understanding the importance of recovery work. So self-awareness, accountability, integrity, and finding a moral compass to help me continue to believe that recovery was possible for me. Things that help me to embrace and stay active in my recovery today is my continued work in service, the fellowship that I have with my recovery tribe. Service is a huge piece of my story, and it's turned into a major foundation piece of my recovery. So sponsorship for others, mentorship, role modeling recovery, being in that leadership role, as well as some of the things that I advocate for across the state with the recovery centers and 12-step recovery. Active addiction isn't a place that we have to stay, and there's a lot to learn from the choices that we're making there, to help us find a stronger path that will benefit our lives so that we can live in healthier ways. I'd like people that don't understand addiction or relate to that lifestyle to know that their support and encouragement for a recovery process or a pathway is vital to individuals that are struggling with active addiction, to feel to feel part of and that it's possible to recover. I would say that for those individuals in active recovery, or maybe not, don't have firsthand exposure to that or knowledge or experience, just to be open-minded and willing to create inclusivity. Three resources that are major platforms that help a community that are struggling with addiction or active use is the Crisis Center, the Center for Hope Recovery Resource Centers, and all mental health and substance use disorder agencies, treatment centers. So for Center for Hope South, we have Narcan available at no cost to the community, on grab as soon as you walk in, as well as connecting with community partners so that they can distribute it into the communities. We definitely put out that awareness that it's at no cost and that anyone's able to come in and pick it up on site. Narcan, in our perception, isn't telling individuals that that they have to stop for us to help them. Narcan is more of a if you know someone or you're in you have that awareness of active use in the community because it's happening, that you have this as a tool to help save a life.